Well, good afternoon, everybody. We're taping this a little earlier in the morning here, but this afternoon when we'll be on our Facebook Live at 5 here. And we just thank you to have a couple guests with me today. Some smiling faces here. We always love smiling faces, especially young ladies. And here we go. We're going to welcome Linnea Windel at VNA Healthcare, and she's president and CEO. She's on the left here on your screen. And then we're going to also welcome her other amiga, my other amiga here, Chrissie is it Howorth is that right? Howorth?
Howorth, that's right.
Howorth, and she's with the VNA also. She's vice president of the and communications. Well, we'll forget that. Well, we'll move on. Sorry about that. Anyway, we're really happy to have these ladies with us. We've been working on a lot of things in the community in the last months here, and I've talked to Linnea a few months ago about doing testing, and they're doing testing and other things during this COVID-19. And why don't you just give us a little background on the VNA and how you got involved, and maybe a little about where you're located at, your locations.
Sure, thanks. And thanks for having us today, John. So VNA has been serving this community for many years. In fact, VNA was founded in 1918 during the flu pandemic at that time.
Wow.
And so over 100 years in the Aurora area. We have clinics in Aurora, both at our Highland Avenue location and on Indian Avenue, or Indian
Trail.
as well. And then we have clinics in Elgin, we have clinics in DuPage County and Will County, 14 locations in all.
Really, 14? Wow. And but your base is basically Aurora. Is your home base Aurora?
Okay. It is. Yep. Aurora is our home base, and we are serving actually 30,000 people who live right in Aurora, and certainly people come to our Aurora locations that are from surrounding areas too. But 30,000 residents of Aurora use VNA as their medical home. So it's been a lot of change these last months as we've adapted to the pandemic and instituted new services, including testing that you mentioned. Just recently, we passed 10,000 test mark. We've administered 10,000 tests during the pandemic so far, and have testing at our Highland Avenue location.
Right.
And so people can come there, and we have testing available every day. In addition to testing, we've made some other changes really to respond to the needs during this time, and really sort of at the beginning of the pandemic, adjusted to set up certain areas of our clinics that would be for evaluation of COVID symptoms. So that's done in specific locations in specific areas. And then we started telemedicine so that some kinds of questions or things that people need addressed could be done safely through telemedicine without them having to come into the office in those early stages of the pandemic. And we continue to have that available for people if they prefer that method and if it works with the kind of care that they need that day. So that continues to be something that we have. And not everyone has a computer or the kind of the things that you might be using during a telemedicine visit. We also do care by phone when we've needed to during this pandemic, just to make sure people are getting what they need to take care of their health. And then as we got into the summer months, we were able to start what we call catch-up clinics. So as the incidence rate decreased during the summer, we started with clinics for diabetes checks, for high blood pressure checks, so that people could come to us outside, in fact, just a drive-up clinic where they could get their blood glucose checked, get their blood pressure checked, make sure they have their medication, really to make sure that people are as healthy as they can be during this time, keep the immunity high, right? And make things just as easy as it can be. And so a number of these services are done outside in a drive-up fashion, similar to what we're doing with testing, where people drive up and get their test.
Yeah,
So a lot of changes in the last months.
yeah, I just thought of something here. I wanted to ask you. It's sort of, I know you have a pharmacy at your place at Highland. How are doctors involved with you? I wanted to ask that.
Sure. Yeah, just in general, VNA provides a really comprehensive primary care. So VNA employs physicians,
Okay, that's what I thought. Yeah.
obstetricians, pediatricians, family practice doctors, internal medicine, as well as advanced practice nurses, nurse practitioners to provide medical care. And we have today about 70 full-time physicians and nurse practitioners
Wow.
serving 72,000 patients across our locations.
Okay, that's what I thought. Many years ago when I had a car accident, I believe, I'm almost sure it was VNA that came out to do a home visit to give me some therapy. I think it was VNA. It could have been through the hospital too, but I know you do those type of things, right?
Yes, we do. So as you're saying, kind of that home-based side to what we do includes nurses who go to provide care in people's homes, as well as advanced practice nursing. So the doctor's house call kind of service.
Oh,
Yeah.
can you do that like under Medicare and if they're homebound? I guess
Yep.
technically you got to be homebound, but right, you can come into somebody's home and basically don't have to go to the doctor. In other words.
Right. So the medical house calls does not require a person to be homebound. Some of the nursing,
Oh,
home
okay.
nursing
Maybe
does,
you got
but
that wrong. I just remember
yeah,
from the past someone like that.
yeah, home nursing does. You're absolutely right. And then the
Oh,
house
home
call,
nursing. Okay.
yep,
But not on a doctor's visit.
but not on the house calls. Just
Okay.
yep.
Because I remember my mom had, it was through another service, it was that through DePage had something that they came out for about
Uh-huh.
a year. My mom had that. She didn't
Oh,
have to go to the doctor. They brought in the x-ray machines and everything. And
yeah,
yeah.
yeah. There's so much now that can be done at home.
Yes. And Chrissie, I don't know if you were involved with this, but this is something I think you probably would have had a little hand in. I remember when we had the Affordable Care Act came around. That's maybe you were. It's a long time ago now that I think about it. It's not a few years ago, but I remember that you folks at the VNA, you provided service on that to fill out the forms. I remember that, and I was very
Yes,
fortunate that I got through that. Yeah.
we recognize that insurance forms at any time are often really confusing and complex, and we're pleased to have benefits assistance provided for anybody who needs it. They can come in and make an appointment with one of our team, and they'll help work through paperwork with individuals and help explain what the choices are so that they can make an informed choice for themselves. So although they're not completing the form on their behalf, they will work with the patient
Right.
or the individual. They don't have to be patients of ours, just people from the community can come in, and they'll help them with making sure that they are able to complete insurance forms for whatever
Right.
they're eligible for.
So there are, I don't know who wants to answer this, but how are people coming in? Well, if they don't have insurance, how does that work? Or do we have some way to help that? I know that's out there. We've talked about the affordable health care. There's so many that are not insured still, and we're worried really if it gets knocked down here. I don't even want to think about that one.
Absolutely.
But how does that work with somebody that doesn't, quote, have insurance?
PNA serves a large number of people who have no insurance, who are uninsured, and we're able to offer a discount for their care, and it's based on a sliding fee scale based upon their income, and so they will pay a contribution towards their care, but it's very radically discounted based upon their income. So there's nobody is excluded from care. I think we've worked very hard to remove all those barriers to care. We know that when somebody is in need of healthcare, they need it right then and there, and so nobody is turned away if they need the care. This is where they're able to come.
Linnea, you were going to say something?
I was just going to add that for COVID services, for the testing and evaluation, and also for flu, there is no charge if the person is uninsured for those services. So Chrissie, described what's kind of our normal, the typical structure is a sliding fee scale, and there's a very minimal fee involved there. But for COVID services and for flu, we have no charge for those for the uninsured, and we are not charging a copay or deductible if that is an applicable situation for their insurance if they are insured.
Thank you. I see our free flu shot Friday flyer up on the screen there. So thank you for sharing that. This is an opportunity for individuals. We are offering flu shots at our clinic through drive-through at Highland Avenue every day of the week. We are also partnering with the City of Aurora to have Flu Shot Friday at Phillips Park, and this flyer runs through the end of October, and we've just confirmed with the city that we're going to actually extend that running up through until Thanksgiving. So we will have some more information which we will share for your viewers. We are alternating morning hours, and so today it was on during the morning. Next week it'll be on in the afternoon from 12 to 4. And again, no appointment is needed for our flu shot clinic. We do require appointments right now for our regular services and also for our COVID testing, just so that we can make sure that we are properly able to serve people when they arrive for their care. But the flu shots, they just come in their car, bring their families, and we're keen to get everybody vaccinated this fall. It's an important thing to have done to take care of for the protection of yourself and also for your families.
Well, that's great about this flu shot, because it's like my friends at the food pantry are, having the food pantry, and what you're doing, it cuts down on some expenses so that people can pay their other bills that really they're not forgiving as much. So their housing or car payments or whatever that may be. And also by having the flu shots, we're hopefully going to be cutting down the amount of people that would go in the hospital.
Right.
We could get overwhelmed in our hospitals. That's what I'm saying. And this flu shot is another way of preventing that. You want to comment on that, Linnea?
Oh, it's so true. This is the year to be sure and have the flu shot. Certainly, people could get both flu and COVID at the same time. So that's a concern. Getting the flu in itself sort of knocks down the immune system and may make a person more susceptible to contracting COVID-19. So this is the year to make sure you get a flu shot. Absolutely.
Yeah, I was always trying to be good on that. My mother, who passed away about 10 years ago now, but she could not. Well, there's different ways to make these shots, and some of them have egg in them, and I think they still do that. They could do it other ways, but they're not. So you can be allergic to the shot anyway. So that was her problem. But I had to have, I know your healthcare workers are the same. I had to have this shot because being around her, that was just not good because I was out and she was not really. And you just have to do those things.
Right. Yep. Absolutely.
There are people who have weakened immune systems. They may be having chemotherapy or issues that prevent them from being able to protect themselves that way. And so by having the community all taking personal responsibility for getting the shot, it protects you, but it also protects our more vulnerable neighbors as well. Our drive-through clinics, including Phillips Park, we can help vaccinate individuals aged 4 and above, so children as well as adults. If they're under the age of 4, we will serve them in our clinics. So we have the 2 clinics in Aurora, and so we are able to vaccinate babies and toddlers. It's just a safer way to be able to do that than in the car.
Right, right. Maybe do they have a different dosage too, or how is that, or do they do something a little different on that with the younger ones?
Yeah, there is I believe a different dose for the very young.
Yeah, yeah. Well, that is a very good thing you're doing. We just got to keep that out in the community to get those shots. We've been talking about, I know they talk about quite a bit about the COVID-19 and they'll get the vaccine, but we got to get people to believe in vaccines. And they can't skimp on how they do that to get that COVID-19 vaccine, though, because we got to get people to believe. It's a long story, but then we got to get rid of that anti-vaxxing idea out there too. That's been building up for years too. So this vaccination is very important here. And I remember when I was young, when you ladies were not even, well, you weren't even around. I was a baby, a young school kid. I remember that polio vaccine. They did it in school. I think it was a liquid. I think we had to go in, maybe it was twice. We had to have a liquid. And that was really done in a nice way. That was it, Jonas Salk. He donated that. He really didn't want to make money off of a pandemic or a polio. And I think that was really beautiful in the U.S. So that polio has been somewhat, I think it's 95% eradicated. It's still out there though, but, and then we got to get everybody vaccinated. So that's
right
in the world and in Aurora and the King County.
Right.
This is going to be, you just can't say, oh, I can afford it and it's all right for me. No, everybody's got to get, like we're just talking about the flu shot or the COVID-19.
Well, we have the opportunity for anybody to come and receive their shot without worrying about cost.
And with no appointment too, so it's very convenient.
Hearing me there, ladies?
We couldn't hear you for a moment, John.
Yeah, I think the streaming went down here, maybe. My Comcast went down, I think, maybe.
Okay.
Are we coming through now?
We can hear you now.
Yes.
Okay, good. Sorry, something happened there. I think my streaming is not as good as it could be. Oh, there it comes back. Maybe I will have to do MetroNet. I don't know. I've been reluctant to change providers, but maybe I will change providers because when you do like Comcast, it goes up and down. It's not fiber optics, so that's another technical side here. And so we're real happy that you provide these services at a low base or free base right now, especially this COVID stuff. You're providing flu shots and COVID on a free basis, so that is very good. And we're going to have that extended. You said probably till Thanksgiving. Is that right, Chrissie and Linnea?
The flu shot.
The flu-free Fridays, flu shots.
Yeah, the flu shot Fridays at Phillips Park will be right up until Thanksgiving. And then we have flu shots going on at our Highland Avenue clinic. Drive up there too, no appointment.
Okay, so you can get those other days then. Is that what you're saying?
You sure can.
So that'd be the same idea that would be free also? Is that the same idea?
Same thing.
Okay, good.
Yeah, and then
you'll be able to.
Sorry.
Individuals will be able to get their flu shots at our locations, at our health center locations, after Thanksgiving as well as before. So it's just the public event that's taking place in the park.
Yeah, when you get snow and other things, and by that, my mailman reminded me. Oh, last year we had snow on Halloween. Oh, I remember that. Now that he said that,
yeah,
that was too good. There was a lot of snow too. It wasn't just a little sprinkle, if I remember right.
Yeah, it was.
So that could happen. That crimps the outdoor type of thing. Pulls that down. But so you'll be offering flu shots throughout the season. In other words, you're saying?
Yeah, yes. We will. We have a good setup behind our building on Highland Avenue for drive-up flu shots, for the drive-up COVID testing, and
really, you're going to do that way too. Okay.
Yeah, and there may be days where we need to do it inside, but we have a good setup. We're winterizing.
Maybe you should go take a look down on the Marie Wilkinson. She said that she's putting up some type of heating system outside. I don't know how they're going to do it. Something up on the top, because they're not having anybody come in the food pantry. They're going to be you pick up a box of food. So it's the same idea, and people just got to get used to it. I mean, it's just the way it is when we have a pandemic. And I think I wanted to show that. I had one more thing I think I was going to, where did it go? Oh, this is basically we've talked about it, but I'll bring it up again. This is the flyer.
As we
yeah, that's your flyer on your drive up. I mean, your appointment for your COVID-19 testing.
Yes.
Yes, thank you.
And that's still out there, and that's going to be ongoing. And maybe I mentioned that. I know I did before, but the state of Illinois today had its highest number, I think, ever. This is not just. So we know the winter months are going to be more. We had 4,000 new cases and 53 deaths in the last day. Some other times when they have spike in numbers, I read that in the paper that, it's on the weekend. There's a lot of reasons why they might have a spike, but this is not that type of thing. They believe we're really into something could be picking up here, and might have to have more restrictions. They don't know about that yet, but definitely got to wear those masks and that type of thing and social distance. And that's one thing I always comfortable going to my doctor. Other than I know you're that way too. Very comfortable because you guys do all the precautions there are. You do everything, and you've been telling people to do that, and that's a very good thing that you're doing, trying to just show the people the proper way to handle this virus. And I really appreciate you guys doing that as a healthcare worker and I want to ask, this is just somewhat related to that. Have any of your people come down with the virus? I mean, I've heard of that happening. Has that been you've been pretty good health there on that? What would you say on that, Linnea?
Overall, we've had, pretty good health, as you mentioned. But, early on in the pandemic, in particular, people, certainly we had individuals who were affected personally. So, yeah, it does happen. We, work really, really carefully with all of our employees,
Right.
To make sure that they're at home.
Right.
Well.
Right.
Mm-hmm.
They're healthy, and I know that's a tough thing to happen to healthcare workers, and it does, because they do very good. Don't I think the studies have shown that they do a lot better than the general public on getting the virus. But if they see a lot of, I guess the word is load of the virus. They can see a lot of people, and it sort of can build up. And yeah.
Well, we do have really very thorough procedures about, the environment, about all of our employees coming in and having, at the beginning of their day and partway through the day, we have temperature checks and screening.
Right.
So
Good.
that anybody who has any of the symptoms would not be working. And then we make sure that our employees have full protective personal equipment. So N95 masks when they're doing certain kinds of care, that gowns, of course, gloves, the face
Yeah.
shields, that people are fully protected. And we went to universal masking April 1st. So we were very, very early in
Right.
everyone in our facilities, and of course all of our employees, having masks on at all times. So we're very, very careful with all of that.
How's this is one issue that's out there, and it's been an issue for a little while. How's the timing on the testing on coming back? Is it,
The testing had been quite difficult nationally back in July, but we are now receiving our results with a very quick turnaround, usually within 24 hours.
Wow, that's good. Because actually, the quicker the better. I mean, a test is a test, I guess, but for the
We have a
people and
lot.
everybody to have it faster is a lot better.
We encourage everybody who has had their test, they receive education at the same time as they're taking their COVID test about the importance of quarantining until they receive the results, staying at
Right.
home with their families. And we've put some useful resources on our website to help
nice.
people not only with isolation, but also with quarantine. So if they actually have tested positive, they need to isolate. And so that's another layer of precaution that they need to take and be very mindful. And they're given advice about the number of days and what they need to look out for symptoms. Of course, we also have the opportunity for anybody who does test positive or who is symptomatic. The provider will work with them to be able to help them manage their symptoms, and so that they understand what to look out for when they should give us a call back or have reconnection with their provider if they're struggling at all while they're at home.
Yeah, so we would help them maybe or you would provide being the primary, whatever you want to call it, primary physician or primary medical for them too, if they don't have that, to work on that when they.
VNA is primary care medical home for our patients, and anybody, people don't need to be a VNA patient to come in for flu shot or for COVID testing. You can have your own primary care provider, but if somebody happens to come in for testing and does not have their own primary care provider, then they are immediately able to be connected with one here.
Yeah, you'll help on that. Okay.
We have a wide team, not only with primary care traditional primary care services that people are familiar with, like family practice, pediatrics. VNA delivers 1,600 babies a year, so there's a lot of care that's happening. We have prenatal care, also mental and behavioral health. There are a lot of people struggling right now, and there is an opportunity for them to come and talk with somebody who will understand and help give strategies for managing this really challenging time that is unprecedented. We also have WIC services here at our Highland Avenue location, and so WIC provides women, infant and children nutrition, supplemental nutrition. We've recently moved to the EBT card, which works just like a credit card, so we can load that and people are able to use that, which is much easier for them than the older system where they would have to redeem coupons in the store. They're now able to use the EBT card, and so we encourage people who have children under the age of 5 and ladies who are pregnant to come and take advantage of that. This is a time where a lot of people are trying to manage food insecurity or struggling with that, and we have those resources to try and connect them.
Well, you sound like you're Linnea and Chrissie together. You really said that VNA is a full-service operation in healthcare. It's just we're just talking on some of the important things on the outside here or in the community, but it's community all the way around. I should really say that. But you're reaching out in several ways, and I always. I remember taking friends up to your clinics, and so we appreciate what you're doing in Aurora. Is anything, Linnea, you want to give us a little, maybe close out here? Anything you can think of you want to stress a little more or whatever?
One thing we didn't mention at the beginning, which as a healthcare organization really dedicated to providing care for everyone, regardless of their ability to pay for the service or regardless of their insurance coverage. We're very focused on the quality of that care and that people have the health outcomes that they're looking for. And we are compared against our peers, our community health centers across the country, of which we are one of 1,200 or so. And for the second year in a row, VNA has achieved being in the top 10% for quality among all of our peers in the country. So it's a very important, a very important value for us here at VNA is that the service that people are getting is of the quality that they expect. So that's very important to us.
I'm glad to hear that. I'm sure people know that too about your quality, and that's a good thing. And you're really trying to reach out to community here with these initiatives, with the COVID-19 testing, and also with this free. Again, it gets my tongue stuck. Free flu shot Friday, it's
a little tongue twister.
Yes,
I'd
yes.
I'd like to add also.
I can say it, but if I can't say it too fast.
I'd like to also add that our services are all available in English and Spanish, and we have translation services in really any language that any of our neighbors may speak. So if anybody would like to visit our website, and I see that you've put the link up there on the screen, that's helpful. The whole of our website is also available in Spanish, and we have videos on our website in addition to the listing of our services and further information about managing COVID-19 at home, whether you have symptoms or no symptoms. And then our additional clinics, our catch-up clinics, we're trying to encourage our students to come in for their physicals, immunizations and physicals ahead of the time when they eventually go back to school. But we want them to have those even if they're not going back to school, so that they're well protected and their families are protected. We have when school is in session, we have a health center within East Aurora High School. So students are able to receive those services while they're in school, in addition to coming and seeing us at the health center. But the health center is open for their families, and then students during term time when school is in session. They can see their provider right there within the school, which is very convenient and helps parents not have to leave to go pick up students. They can be assessed and maybe return back to their classroom. So it's an additional service. But English and Spanish for all of our flyers and the information.
Right.
So we encourage people to
Very
check
good.
that out.
Well, if you want to learn more, I put up the website here. You can see www.vnahealth.com, and I got a lot of things there to learn more about VNA. And I just appreciate these ladies being with us today. I know this is a little extended interview, so I hope some of you can, learn more and just listen to this. I've enjoyed this time together, and I want the ladies to still be around here. I'm just going to give you some announcements, but before I do that, though, I got to give them a thank you, though, for coming and being with me today, Linnea and Chrissie both. I want to thank them for doing this today with me. And here's a couple of things. I'm just going to give a few quick announcements. One is get that vote out. Vote for 2020. If you, it's not too late to do that, and you can do that several ways. It's not. I got the census. I got that. Oh, come on now. I got goofed up there again. Well, that's an important thing too. And here's where I wanted to get you to. The county clerk here to find out about voting. So I did my early voting. It's already been counted. Well, not counted, but it's in the tank, as they say. And they show that you can get it tracked. So it's a good thing. Let me see what else we got here. One more. Probably I was gonna mention about the Fridays here again. Yes, remember the Fridays, but I got the wrong date on here. Sorry about that, ladies. But just remember the Fridays at Phelps Park. That's a very good thing happening. And so all I can say is for everybody out there, we'll see you next Monday. And Lord willing, the guest will be Joe Jackson of Hesed House. That's Lord willing. We've had a lot of things happen, so it could. But Joe's going to be with us, and we really appreciate that. Again, thank you, ladies, for being with me today and bearing with me here. And we'll keep informed here, and you keep me informed what's happening with VNA. Any way I can help, I just want to be a service to you and the community. So just thank you again for coming by, ladies.
Well, thank you so much.
Thank you so much for inviting us.
Yes, thank you again. And now all I can say is God bless out there, everybody out there. God bless, and bye-bye. Bye-bye, everybody.